This is the last ALR circle for this year. And what I've been doing for the last 10 days is I've been in back-to-back meetings with the state and the health department, anybody else. And I try to put it all into a bucket of stuff of things you got to get done before the end of December. I'd like you to get it done long before that so you can enjoy the holidays with your residents and families. And if you get all this stuff off your checkoff list, this will be fabulous because we have a whole pile of new stuff hitting us February 1st. We'll be spending most of January trying to figure out how to make that all work. And then we'll be sharing that, and we'll pick up the ALR circle again, late December, early February. So some happy thoughts. You always need some happy thoughts. So we're supposed to get snow tomorrow, and people are starting to bake, which is really cool. And then I've actually made some soups and stews and got my fall cooking going, but I haven't been able to slow down yet. It's been wild. So some news. So the federal government has till tomorrow to notify the states if we're going to go past January 11th on the pandemic. And that's the money that the feds have been giving the states to manage the pandemic. I wasn't super hopeful that we was going to go past the 11th until RSV broke out in the country with all these kids. Now that the pediatric world gets to see what we went through 2 years ago, they're crying foul, help, help, help. And the money comes from the same agencies. So the PHO may go through March just because of the kids stuff. And then we are having an uptake in some states in COVID and Omicron both. And so, like I said, right now, the last I heard is January 11th. We'll have to see what comes out by Monday. All right, there's a lot of memos coming and paperwork to families. So because of we're starting to wind down, families are starting and residents are starting to get redetermination paperwork, and it's essential to get it signed, get the bank statement in, and then cruise through it, just see if anything's totally glaring stupid. Don't change everything. I wouldn't bother. I would just get the bank statement in, make sure their demographics is correct, get their attestation on it, and get it back to the counties, because they've got what they say the other day, something like 45,000 to do in 3 months. It's a lot of work. Okay, and they're going, and the renewal notices are, as far as I'm concerned, they're very stupid and overwhelming. And I've actually went back again and started advocating that we have a one-page renewal form and see if we can get this thing settled down. Okay. All right, so the WHO organization said that if we could get everybody vaccinated across the country, we could save 90,000 people. If we don't, this is how many people we could lose this year. So we're at super high risk as an industry, and the arrow's on us. And so they are blaming the deaths on long-term care and assisted livings and why the death rate's so high. And in reality, in assisted livings in Colorado, it was extremely low. So I'm trying to keep it positive that Colorado stepped up to the plate and we had a really low death rate. It was community death rates that was a mess. So right at the moment on booster 5, the new Bellavent, which is not the same chemical makeup as the original 4 COVIDs were. It's a different makeup, and it actually, in my case, I didn't feel good for about 12 hours, but then I was okay. But about 3 days later, I got my brain fog went away. I got this renewed energy and started feeling like 1,000% better. So I'm really trying to get people to do it because we're hitting only 30% of the community. And that is going to impact us. And I don't want to go back to shutdown. I'm not interested in going back there. So the federal courts knocked out the medical waivers because all of the experts said it's the high risk people that need it the most. And so you cannot accept a medical waiver for, I don't want to do this. And I get calls every day. And if you only have one house and one business, you cannot take any waivers. You can't afford it, because liability insurance has been very clear that if you have a death and you're sued, they're not going to cover you if you have any waivers. And you just cannot afford a lawsuit. Okay. So you're going to be on your own. So you could have $100,000 lawsuit against you if you don't get everybody vaccinated. If you don't have the staff rosters and the census rosters that I've built and given to the industry, you can email me, I'll give them to you. Every place that OSHA or the state's been and they've seen the rosters, they've been very happy. And it gives them a bird's eye view of everything, the dates of everything. And then they don't go looking through all of your records trying to make their own roster. So this is a really important to have at your front desk for any, when state or OSHA shows up at the door. If you have an outbreak, it'll be OSHA. If they show up at the front door, and you can hand this to them immediately, it will take down the tension. All right, so Bellavent, it protects both against COVID and Omicron. It was developed in Israel and with Germany and with a country in Africa. I can't remember now who that was. But anyway, it is really improved. And once we can get everybody done, we're good for a year. We don't have to mess with this crap anymore for a whole year. Whether or not we're going to have to do flu and COVID shots next fall, I do not know. But right at the moment, it'll give us a year reprieve. We have 16 variants in Colorado. Colorado Lab is doing most of the research for the whole US in conjunction with 2 other labs that are at universities. And so it's kind of interesting. Colorado has taken a big lead in this. And so there's a new one called Q, and it is over in Europe right now, and higher upticks of it. It does not respond to anything we've done to prevent it, and it is kind of growing its own legs. So we are watching that. All right, so for the folks that are not taking RNA, there's an alternative. And you can use this slide to talk to your people that have got stuck in the mud, that they don't want to do the COVID. They can do this alternative, and they will accept it as protection. Okay. All right, COFI. In your COFI accounts, there's a file called flu vaccines. You have to fill that out probably weekly until you're fully vaccinated. And then after that, you just need to go in probably on the 1st and the 15th when you're doing EM resource. So they're different entities, and different people are looking at those files. State sent out a letter yesterday saying that EMR and COFI is really behind, and they're going to start issuing tags for immediate jeopardy and fines of $500. So make sure you're on the 1st and the 15th minimally. And then on the vaccination file, please read the instructions. So if you have a vaccine clinic, they want you to put that in. If you have an outbreak, they want you to put that in. So they want you to keep COFI up. Because again, we didn't have flu last year, and now it is really here with a vengeance. Okay. And then again, make your rosters, keep that, have them up to date, show good faith, and then that will keep you out of a jam. In each of your facilities, you need an infection control coordinator. And I'm working in small groups. I worked with a group here a few days ago, having them look at what I'm thinking of doing, how we're going to tackle it, and then the education that goes with it on co-train. And so I'm going to do other small groups if people want them. Otherwise, you guys can do what you want to do. But you must have an ICC, and it must be not you. And I would really encourage you to have staff help you with this. 1, it gives them a sense that they're doing something to help the facility. 2, it also gives them a little bit of a raise for doing the work. And 3, it takes some pressure off of you. So not only once you get they can do the rosters, they can do the trainings, they can set up the additional trainings, because you need 2 trainings a month, about 20 minutes each, and they can do the resident meetings and give them some skill building in leadership. So I put this in, and when you get your file deck, you can go in and get this communication down. It just came to me this morning, so I added it for you, so you'll have it in your stuff. All right. Much to my sadness, we got a new vaccination plan about 2 weeks ago. And I just told people to fill out the parts that's not on the original one and attach it. Well, nobody did that. So now the state has been writing POCs that the vaccination plan is incorrect. And so I've given you the new vaccination plan, and the state asked that we don't just fill in the blanks, and from the old one, they actually want a complete full plan. So here it is, not too hard to do, and you should be able to handle that. All right, so this came nationally from the FDA. And so this is the new flu world. So for our older adults that are high risk, people my age and older, you're getting the quadrivent, and it's at HD2V4. And then younger people are going to get the R1V4, and then the younger population will get the AV4. So we have some different kinds of flu shots, and none of them have the old base. So back in yesteryear, in the early 2000s, I worked for the company that actually built all the vaccines for the whole world. And they had to put in stabilizers to ship it and get it shelf ready, because they didn't have those deep freezers like we did when COVID first came out. So any rate, that's what made people unhappy, and their arms hurt. They were nauseated, or they would have fevers, or they just felt like hell afterwards. And so they've been able to modify that. So if you will see, it's inactivated, okay? And then recombinant means that it's a combination of active and inactive. And then ajuvenated inactive is totally built off of DNA. So what of the older people, anybody that smokes, anybody that is AIDS positive, anybody that's got any cancer, that type of thing, they're going to get the HDV4. The cool thing about this is any of those three can go with the COVID-19 Bellavent, and they can get them at the same time. Okay. We have two new flus in Colorado. I haven't seen these since the 80s. And they scare the crap out of me because I had a terrible experience in the 80s with both of them. So one is pig flu and the other one is bird flu. So avian means flu, swine means pig. Both of them originate from those two animals. And if they get into the human body doesn't like them. And so they're pretty darn sick. So back in 85, it was the first time I ever dealt with bird flu, and I lost 100 people in a month. It stuck with me my whole career. What could we have done and done better? And I don't want to be in that shape again. So that's why it's so important that we get this done so we don't have this. So when flu shots are built, please understand they start down in Australia and New Zealand every year, because they have summers when we have winters and vice versa. So when they do all those studies and the blood studies and the tissue studies and all that, it starts down there. And they have a great big, huge in Australia epidemiology program. And they build the early vaccination shots. Then it moves up and through the African continent, over Europe, over the North Pole, and then down through Canada to us, and then into South America. And it's been that way my whole career. So this whole thing, is a whole year cycle. Well, the flu shots for next year are already being worked on in Australia right now. And they study the cell structures and when people end in the hospital or doctor's offices, or they get labs done, and they're able to track and trend in different parts of the world. So it's very fascinating, actually, and quite a career to have. So you need to train your staff. So again, gave you the jump, Project First Line. This is all you need to do. Don't make it any harder than this. We're going to have enough crap next year, and it'll make it harder, but just do this for now. Make sure that every month you have a hand washing in your staff meeting once a month. And then right now we don't have to wear eye protection, but if your people are not flu shot, they are back in mask. And then if we have an outbreak, they're back in full PPE. And so again, to get compliance and get people on board with this, you've got to take the leadership role, but they may not work without a mask the full shift. Okay. You want to check your visitors in. And again, we're asking for self-reporting. We just had an outbreak in a facility in South Denver where the visitor brought 2 sick kids in, and then we had over 30 residents go down. So again, that facility is under huge scrutiny for not figuring out that these kids were sick. Okay. You want to have your staff be truthful with you. You do not have to pay like we did in the early days of COVID for downtime when people are down. In the new RCF, there is an outbreak status map to use. And if your people are fully vaccinated, then they are off until they're asymptomatic without a fever for 24 hours. And right now, this combo thing that we're seeing, this RSV Omicron combo that's hitting the older adult market, yeah, it's usually taking people down for about 2 weeks. And so everybody I've talked to has had a really rough time with it. Okay. If you have an outbreak, the only person that has to be in quarantine or isolation, depending on the situation, is the residents that are impacted, and then roommates or anybody else that's symptomatic. The rest of the house has a normal life. All right, so this new ICC person. What happened was that the state recognized in all their visits that nobody was really taking charge of this, and it was scattered all over, and it wasn't systematic. So they got an emergency order to get an ICC person. In nursing homes, they have full-time ICC people. That's all they do. In our industry, I'm thinking it's going to take about 2 hours a week once we get everything fixed. So I've developed a what I call an extended job duty for people to look at and see if that will work for them. The training is on co-train, and then they have to do really good communication with all the rest of the staff. One of the things that we need to get done, and this will be different for every facility, but we've got to get the N95 fit test done, because again, if you have an outbreak, OSHA will be at your place and they're going to want to see the fit test. And if you don't have it, you'll have an OSHA fine. And you can have other fines because OSHA tattles on you, tells everybody. So again, this is one of those things you've got to get done before the end of the year, is figure out this fit testing. All right, so here's the mandate and how to do it. Now, the bigger facilities may be able to train somebody that's going to actually stay, and they could be the fit tester and order the equipment in. And so that is a potential, because you're going to have to do this every year, and I'm going to recommend you do it in August or September yearly and get this on a cycle, so that you're doing your training, your retraining, your discussion points, building your tools every year, August, September, so that you're ready to roll. And then any new employee has to have a fit test within 30 days. Even if they've had a fit test someplace else, we cannot use that information. All right, I want to talk about this. So we've had facilities and surveyors go in, and they are tagging, because they're asking the question about the Colorado Clean Air Act. This has happened all over the state to me. And it confuses people, because we have federal smoking laws and Colorado smoking laws. So this jump, I want you to print. I want every staff person to have a signed one in their HR records, all residents sign if they understand about clean air, because we're having some really weird new challenges with people buying cigarettes and lighters for other people, not smoking in designated areas. I'm kind of worried about how we're going to handle winter, because OSHA is saying you have to have a winterized smoking area, and how we're going to handle that, I don't have a clue. I've been looking for some sort of structure that wouldn't burn down. I haven't found anything particularly exciting to me at the moment. So we have staff violations as well. So I was at a facility, got to the facility, 3 of the staff were smoking at the front door. If we don't do it and our staff don't do it, our residents aren't going to do it. So again, this falls in your shoes as the administrator to make sure it's 100%. You also need to put up the federal non-smoking sign at your front door and all your exit signs, non-smoking per Colorado law. And you can do this Colorado Clean Air Act. I found them at Home Depot and Office Depot and over at Lowe's and online. And so you can use this one as well. And so the difference between Colorado and the feds is the feds say 25 feet from a public building. Colorado says 15 feet from a residential. So I was talking to some HUD people. They're struggling through the same thing, because they weren't there all the time. They were working at home. People start smoking in the hallways, on the elevator, just doing what they wanted to do. And so several buildings told me they gave eviction notices to all those folks this week. So, you're not the only industry that's suffering from this thing, but the surveyors will ask you, please show us your policies for the Colorado Clean Air Act. And that's why I'm bringing this back on the table, so that you recognize it. You have your policies, you have your how-tos, you have your training, you have your attestation, you have it with your residents that are smokers. The other thing they're looking at is you're looking at your trash cans. So your trash cans have to be fire resistant, and there's a stamp on the bottom. I have found them at all the Restaurant Depot place. I found them at Home Depot, Lowe's, Walgreens, I mean, not Walgreens, Walmart, Amazon. So they're there. And some of them are a little more expensive, others are cheaper, but you do have to have fire resistant trash cans if you allow any smoking by anybody in your facility. All right. PTP is a Medicaid product. Some of you that do a lot of Medicaid are working on this already because I'm helping. We're trying to find some language on a couple of things, trying to figure out what we can get away with so that we can keep people from smoking, using marijuana, drinking, and bringing in all their friends from the homeless camp or the prostitutes. We were doing really well during COVID because we were shut down, but it's back in my face again. So the only thing that I can figure out right now that I put together is this last statement: no smoking or use of vapes, et cetera, on the property. And it's a Colorado Clean Air Act, so that's why they have it, the attestation. They can't say they don't know about it. And it's in their emergency folder in their room as well. And we're going to have to really push hard on this. And then staff compliance. These are some other things in PTP that we're working on. So I've written these 3 statements for folks to look at. They may help. I'm not 100% sure yet because I'm still in a snowball fight with Colorado on several of these issues. But this is what we've come up with. So due to changes, residents and employees may need to respond to state directives based on community levels. And so, things could change. We could go on an outbreak status. The whole community could go down into emergency status. We just don't know what's going to happen. If we have any other emergency that the facility cannot shelter in place, like the Superior fires, or if you're in Florida, the 3 hurricane storms that have hit facilities in Florida, or you have a massive flood, whatever, residents will be given directives for safe evacuation measures. And then you have to have a whole emergency plan. And I'll talk about that here in a little bit. And then I played around with this statement to put in the PTP and see if this will be okay. And so I'm trying it in 3 places. So far, I have not had rejection on this particular one because it is for all residents of the building. So we'll see what happens. I'll let you guys know if I win or lose on this story. All right, so the other thing that came out is the feds told Colorado that we have to put in our house rules if there's a violation. So I went, that's why I was calling all my friends that work in HUD. I said, what do you do? So they gave me, this is actually, I just stole it from the HUD rules. So if a resident violates a house rule, the resident will have an opportunity to meet with the administrator. In this meeting, the service plan will be reviewed, revised, or the resident will be informed of next steps. So I'm going to see if this one will fly. I'll let you guys know if I can get this through. All right. Next thing on the bucket list, all facilities need to have person-centered care training. So I had started it before COVID, and then during COVID, I set it on a shelf. I dug it down about 2 weeks ago, did some revisions on it, test driven it a couple of sessions, and pretty good response. So this is my proposal. I'm going to have person-centered care training on Tuesday afternoons at 2:30, and not the week of Thanksgiving, not the week of Christmas. If it's used, I'll continue through January. If it's not used, you guys are on your own. And so any rate, 10 people per session. Lena's helping me figure out how to get the registration to work. And then once you train your PCC training at your house, please invite the ombudsman because they've got another lens training. And I want you to complement what I get you started with them, showing the state that you are working with through all your departments. And then I will give you a heads up in February, we've got a whole new bucket of training in this model. And so we're working on it here and with some of our community partners and trying to wrap our arms around next steps. But this training I'm giving right now is to introduce the language, the concepts, what's diversity, what's inclusion, what is, how do you have a person-centered community, and it's not about the staff, it's about the people, and getting that conversation started. So I'm hoping that this will help the industry. So you do not have to be a Medicaid industry to be tagged for not doing person-centered care. This will come from grievance or complaints. And if you're private pay and have complaints at the health department, the first thing they will ask you is for your PCC training and your documentation. So it doesn't matter how you get paid. What matters is your staff understand the language and the concepts and start actually respecting and taking care of people and redirecting them when it's against for the whole community, like smoking in the house would be one against the whole community. And so this is where we are. So PCC is not going away, and it's actually going to get a lot more stringent next year. All right, so the other thing, you guys might have gotten the email. So we got like a 48-hour notice that we had to have all of our staff certified with American Red Cross or American Health Association and have those 1 year or 2 year certifications. So I called both agencies. There was not enough trainers. So I was like, okay, we'll do our best, and we're just going to start working through this. Well, all of a sudden, 2 days after that, they were going around to facilities and giving IJs. And so there is a class action movement. So you might have seen the email from the department explaining, because we took it to the AG's office and the governor's office. And so that's why you got that email. We still got to get it done. And this is a must. So this is one of your top 3 that you have to have done quickly. If you are large enough and you want to send somebody through to be the trainer and get certified through American Red Cross training program, then we'll have to have that training certificate, and then you can do your internal training through as you need to go. So just make sure that it has to come from American Red Cross or American Health Association, none of those other vendors, okay? You should get a card, and it will be one of those 2 agency cards. It's on a QR code. And then those cards copies go in their HR files, and then the staff need to have them in their wallets or whatever they do with them. But if you did use a third-party vendor, what we're trying to do right now is to just see by some chance that their trainer was certified appropriately. And if we can get the training certificate, then we're going to see if we can use that training. Otherwise, we have to train all over again. And I was not happy because, again, we didn't have the people across the state enough people to do it rapidly. And we had to rock and roll on this. So if you're struggling through the CPR first aid, you might want to call me next week, and I'll see what I can do to help you. All right. The next big push that we got to get done is on fire and safety. There is a risk assessment sheet. These are done on admission and then updated yearly. And then there's a summary sheet. So we're going to try some different things and see how we can get these done more effectively. And then take those scores and put it on the summary, and then look at the summary and figure out who our 2 highest risk clients are, and then tag our evacuation map with 2 little red dots so that the fire department knows who the 2 highest risk people are. It's in your fire and safety book, your summary, and then each resident has a fire and safety sheet. So I have them, and I'm glad to give them to you if you don't have them in your stuff. And we need to drill and make sure that we are hitting that marker of under 5 minutes to empty your whole facility. And then once you get it, then you can go on normal fire drills, but you've got to hit that 4 to 5 minute marker. Okay. All right, so certificate of compliance. So again, facilities are out of order. So this is the certificate of compliance website. It costs you $500 a year. And then just so you know, if you're Medicaid certified, the fire department will be inspecting all of those agencies. If you're private pay only, then the health department will do it on if they do a grievance or a infection control or your routine, they will be looking at your fire safety book. So this blue jump print, it's your policy. Don't work too hard. And then just make sure that you've got that risk management tool done, summary done, and your dots on your fire map. Okay. 2023. I'm working on an idea and working with some young groups across the state that like to do things and see if they'll help us build go packs. I've got go packs in some of my facilities already. We had them before COVID, and then they've kind of fell apart. Now we're going to redo it. So when we have an evacuation drill, the residents will pick up their go packs, and this will take some training. Okay. The other thing we figured out was to put an emergency binder in each resident's room. And depending on your model, what I put in the darn things. But these emergency binders is, again, I'm tired of the health department saying the resident said they did not know any of the regulations about fire or evacuation. And so we're doing these books and working on reminder tools so that we can get out of this jam. You need to have a master copy of MARS for every resident, and you're going to use it in several places. One will be part of your quality plan. One of it goes in the MARS book for every resident, and then a copy of that should be cloud. And the reason you want this is that the state will pay for 3 days of medications if you have to evacuate and you can't take your cart. So that's the other reason you got to have it, so that the state will pay the pharmacy for those refills. Okay. We also got to educate our families better on evacuation, and fire drills. I've had families tell me they told their loved ones not to participate, and that's not acceptable. So again, leadership, good communication, and a lot of people understanding that we are a licensed business and not and even apartment buildings, you have to participate or you could lose your lease. All right, so another thing I want you to put in your book for emergency preparedness for 2023 is this publication. So this comes from OSHA, and in January, when I pick this back up, I'll do more talking about it. But at least if you will get it and take your highlighter and do some, looking at it and highlight anything of importance, so that in January, when we talk about it, you can be more prepared. Same thing for these two things, okay? So CMS oversight, and because our surveyor program comes out of the health department, that whole program is funded by the feds. Therefore, we are under that oversight. And so I want you to get it out and understand what it is. And it's not negotiable. It's not for people on Medicaid. It's all 800 facilities in the state. And so have that, so that again, in January, we'll do more talking about it. On this assessment tool, this is the next thing that is coming on. And you can get these started. And again, it's some of the work that I want to tackle more in depth in January. All right, so here's the stuff I've been putting in the resident notebooks. I've been using red in most facilities, and then a hotel holder on the back of their doors seems to work quite nicely. So their demographic sheet copy, their master medication list, advanced directive, at least the most form in the DNR, a copy of their service agreement, because I'm also tired of hearing that they don't know what their rules are. Memos for changes, if you put any memos out to the residents or families, it goes in their book, and a copy of the house rules and resident rights. This is where I'm at this point, to see if I can calm this noise down, both by staff and residents saying, I don't know, I don't know, I don't know. Because we got to fix this issue as an industry. So what's coming up? So beginning of the year, I've been talking to people and looking at this. My thinking is that we need to do what the rental market does, and most rent agreements are on the calendar year. So I'm thinking that it might be smart for us to change our way of doing business, and we do the calendar year. Then if somebody moves in mid-year, their contract ends in January, and they would be on the calendar year cycle. Because again, it gets really confusing when you got too many cycles and you miss, and you don't research somebody, and you don't do a research on your Medicaid, and you don't do it for your service agreements, and you don't have the right rental agreement, you lose and they win. Then we have to have a annual safety assessments for smoking and cooking. We got to use simple English. Okay. We're going to tackle the emergency plan. I don't know why I didn't see this for so long, but I've got it down to a pretty simple science. We have 2/3 of it done. You guys don't even know that yet. So if we get this fire and safety stuff caught up this month, you already got your infection control stuff 90% done. Just do the fine tuning. And then all we've got to do is the evacuation plan, and we'll have our full EMP for 23 completed. Okay. You need another area for 23 that we're going to do some collaborative discussions is how do we improve resident engagement? It's a quality issue across the country. So people have, are way behind in engagement and making that work. And then our other area that we're really behind in is engaging our families so they understand our business models, what we do, what the purpose of our industry is, and then the rules of engagement such as evacuation or fire safety, or how to fill out a grievance form, all of those things. So we have to really do a lot better job of how we're communicating to our staff, to our referral sources, to our single entry point case managers, to PACE if you're with them, our families, all of them. We're going to up our game in communication. So Eileen and I've been working on this for a little bit. We've actually got it launched. We're working on a program. It's literally in our heads called Next. So Eileen's doing a bunch of lunch and learns. They're on our website. They're in our YouTube channel. You can clue families to go to our YouTube channel and learn a lot of different things. So they're about 45-minute discussions on different topics. And they're free to all our families. There's no charge. If they want to donate to us, we love it because we use it for other things. But again, it's to help this communication tool. So you don't have to invent the wheel. All you got to do is get people to our YouTube channel. Okay. All right. So for those of you that are owners and in charge of contracts, I want you to think about something. I would highly encourage you to use the Colorado statute rent agreement form for the money part. It's month to month. And when a resident doesn't pay, just happened this week, then we executed, we gave them the 3-day notice to leave for a lack of payment, and the resident is leaving. And so it's not a behavior contract that we got to play all these other head games with. It is literally the money. And the single entry points, the APS, all ombudsman, they can't stop it because it's a money transaction. If you have it all in one, you will not be able to get rid of the resident next year. So you have to make a decision how you're going to handle business. Okay. And then we're going to do a whole new thinking about service agreements in simple English. So the parts right now will include things like the house rules, resident rights, what are core services, what are enhanced services, what are special services or amenities. So for instance, I had a family call me today and they want their mom to be able to take the dog. So I said to them, if we can find a facility willing to take the dog, there's going to be a rent fee per month for the dog. There is going to be a fee for if the mom doesn't take 100% care of the dog. And there may be a deposit fee. So are you guys willing to pay that? And they were. So again, if we just be open and talk about it, I think we can, get through this without turning totally gray. So this will start in January, and the Colorado statutes have been in place for several years, and so it's online and it's very easy to use. It's not hard, and I highly encourage you guys to make a decision. Because again, if you have it all in one, you're going to have to get permission from the health department to discharge anybody for any reason. If you have it on the money side only, the eviction courts will hold it up, and there's a 3-day quit and a 10-day quit to get people out. So I had a call earlier this week from a facility, and the lady hasn't paid in 3 months because she was giving all her money away to a dating scam, and she got took really bad. And so everybody's telling her she couldn't discharge her. And if she'd have had the split agreement, she could have discharged her. So right now we're in a major, challenge of where she's going to go next because she hasn't paid in 90 days. Okay. You might have got an email in the last few days from HCPF called the National Core Indicator. Most of you would have been on Medicaid for at least a year if you got it. I printed it out, started looking at it. It has no language that we're accustomed to. It's got a lot of coding and a lot of craziness. If you got this national core indicator, you're going to get a drop dead date to have it in, or your Medicaid payments will be held. You may have to call me. I'm going, and I went through and kind of penciled mine through to try to figure out the easiest way to navigate that thing. And the ones I'm seeing are due Tuesday. So again, if you don't want to get paid, don't do the indicator. If you are a Medicaid provider and want to get paid, you should have gotten this email if they need it this next week. And I think they're doing it in groups, small groups. And so you may get it in a couple of weeks or so. Again, I'm open and willing to help with it because it took me about 20 minutes to read it and try to start figuring it out. So again, a lot of checklist stuff. For all of you that have attended today, Lena will send you, I went ahead and did a Word document for the checklist so you could organize and check and say, yep, done, yep, done, yep, done. Hopefully that'll help you. So January, we're going to deep dive in a couple of these areas a little deeper so you can understand them better. And then I'm getting ready. I'm just starting to build it. We are considering, we haven't made a final decision yet, but we're probably going to offer a secondary training for administrators to give you an advanced training master certification, because you guys have learned so much in the last 2 years. And I'd like to see if we can honor that and give you recognition for a master level certification and see if we can get that launched. So it'll be a 2-day course, 16 hours, and we'll go over some of the regulations that Eileen always does in our classes, and then we'll do the advanced course stuff. And like I said, a lot of it, if you've been attending my ALR circle, you kind of got an idea where my head's at, because it's where it's going to come. The second thing we're going to do in the memory care world, for those of you who do memory care, especially if you're locked, the memory care circle will launch in January, and have different people across the state that are really willing to come in, and we're going to work together to build an ALR circle specifically for memory care to meet all those new criteria that are coming next year with all the new state laws that were passed. So thank you for coming today. Lena will be putting this on our YouTube channel. You can watch it over. You can call me next week. I won't be here tomorrow, but I will be here all next week. And I'm glad to answer your questions, email, call me, whatever you need. Use the checklist, and please do everything you can to get done and caught up, because I need your energy, and you're going to need your energy in January to actually be ready for February. So that next year is a lot smoother than what we've been experiencing, because this has been really choppy. So we've got about 15 minutes. I'm glad to answer questions.